Well, hello everyone, and welcome to today's webinar, ACOM Advocacy Updates, Protecting and Promoting OEM. We have our presenter today, Katie Vanlandingham. She is our Advocacy and Legislative Affairs Consultant. We are delighted that you guys were able to join us today for this timely update. My name is Nikki Hoffman. We also have Julie Ording online from ACOM's staff. I'm going to go over quick housekeeping items before I turn it over to our presenter today. First of all, you are able to chat messages to our panelists or attendees. Feel free to let us know where you're joining us from. We kindly ask if you have any questions, we're going to be taking those at the end of today's presentation. Please put those in the Q&A box. We will do our best to address all questions that are relevant to today's presentation. If we're unable to get to those, feel free to send us an email and we can try to help you out post-event. For those that are new to ACOM, ACOM is a membership organization that provides leadership to promote optimal health and safety of workers, workplaces, and the environment. If you are not an ACOM member, we encourage you to join, and there's that link there. Otherwise, I'm happy to connect you with our membership director post this webinar if you want any more information or questions. And now I'd like to turn it over to ACOM's Executive Director, Julie Ording, to introduce today's webinar faculty.
Thank you, Nikki. It is my pleasure to introduce Katie Vanlandingham. She is ACOM's Advocacy and Legislative Affairs Consultant. With more than 20 years of experience in federal funding and healthcare policy, Katie brings deep expertise and a strong track record of advancing key initiatives. She has been a leading advocate for increased funding for the National Institute for Occupational Safety and Health, or NIOSH, and its education and research centers. These efforts have helped secure a $28 million increase in NIOSH funding over the past decade, including more than $5 million dedicated to ERCs. Katie currently represents the Association of University Programs in Occupational Health and Safety and has previously represented the National Safety Council. She has extensive experience working with nonprofit organizations and has helped many clients successfully secure federal funding and achieve their policy objectives. She has also led numerous annual advocacy trips to Washington, D.C., including one effort that helped launch a national coalition and drive sustained increases in federal research funding. Please join me in welcoming Katie, who will provide an update on federal policy developments impacting occupational and environmental medicine. Katie?
Thanks, Julie, and welcome everybody. Thank you for having me today. I just want to give you a little bit of an update on, well, I'm trying to advance my screen here. I want to kind of go backwards a little bit and talk about fiscal year 2025 and 2026 funding. It's been a little bit of a difficult year. I guess that's a good way to say it. We started out last January with a new administration and with DOGE coming in, reductions in force where NIOSH staff was cut by about 90% in April of 2025. The president's fiscal 2026 budget only included $73 million out of what the previous year had been $362.8 million for NIOSH, and didn't include any funding for the ERCs. The new administration proposed moving NIOSH to the Administration for a Healthy America, which hasn't ended up materializing at this point, but that was the proposal in last year's budget. In the meantime, the FY25 bills Congress didn't end up being able to pass them, so they ended up in a continuing resolution for the entire year, which caused a lot of delay and uncertainty in getting fiscal 25 funding out the door, which included to the extramural programs at NIOSH, including the ERCs. There was a 43-day government shutdown due to Congress's inability to pass those FY26 bills. Finally, we started to come out of the darkness a little bit, and Congress did pass those FY26 spending bills. in January. And then also in January, the NIOSH RIFs were rescinded. So it's been a little bit more good news as we've started to move towards fiscal year 2027. I did want to review fiscal 26 a little bit. So originally, after the president's budget came out, the House and Senate and their labor, health, and human services appropriations bills. The House had had a $50.1 million hole, I guess, from what NIOSH had previously been the year before. But they did include an increase for ERCs in their bill. In the Senate, they included a little bit of an increase for NIOSH. There was also a $1 million increase in there for the National Firefighter Registry for Cancer. And then the ERCs were included at 32 million. So then we had to wait a little while for us to get to the end game for fiscal 2026, but eventually they got a conference agreement and the bills were signed into law February 3rd, 2026, where NIOSH ended up with an increase for 2026. So that was a positive move after everything that had already happened last year. But NIOSH ended up at 366.8 million. That was 4 million over the previous year's level. And ERCs were at 32 million, which is the same as the previous year. So now, after 2026 was signed into law, at the beginning of the year, we typically move into the next appropriation cycle. So next funding cycle. So now we're working on fiscal year 2027, which will start at the, October 1. So this is the time of year where you have all of the requests go into offices and the offices are making requests of the Labor, Health, and Human Services Subcommittee, trying to get as much money as they can in the budget before each chamber writes their bills. So, well, first of all, the president's budget for fiscal 2027 should have been sent to Congress by the first Monday in February. There is no penalty for missing that date, and the administration typically does miss it, but we still have not seen the fiscal 2027 budget yet. But we're expecting it the week of March 30th, so pretty soon. It remains to be seen what will be in that budget. Last year, as I had said before, the budget included only 289.8 million less than the prior year funding and did not include funding for the extramural programs like the education and research centers. But since that budget and since the fiscal 26 bills were signed into law, the NIOSH RIFs were reversed, and Congress did include increased funding for NIOSH. So we'll have to wait and see what the fiscal 27 budget reflects and whether the administration will continue to recommend a cut or if they will again try to recommend the new agency administration for Healthy America. But you have to also remember that the president's budget is not the end all be all. Congress is the one who determines funding. So the president's budget is just one piece that kicks off that process. So then I wanted to talk a little bit about ACOEM's priorities for FY27. Ultimately, the top line, goal is for enduring funding for OEM residency programs, including exploring new programs and funding options. This includes at least the 366.8 million for NIOSH, which was the 26 level, and at least the 26 level of 32 million for the education and research centers. It's important to try to maintain that funding for NIOSH and for the ERCs while exploring other options. We're also seeking some report language that encourages NIOSH to prioritize ERC grant and training project grants that solicit for applications that propose to expand the occupational medicine residency programs. Some of the ACOEM leadership did meet with some congressional offices on March 5th to discuss these requests. And we focused on states that had residency programs and some members that were on the Labor, Health, and Human Services Appropriations Subcommittee that appropriates funding for NIOSH. So then I want to get a little bit into the general outlook for fiscal year 2027. So, as you know, the both chambers have to mark up bills. So it starts with the president's budget. The House has to write their own bill. The Senate has to write their own bill, and then they have to come together and figure out their disagreements and come to a compromise. Um, all of this is supposed to happen by the end of the fiscal year. Of course, the last many years it has not happened. So usually a continuing resolution is needed. But this year, the House is expected to aggressively take up their FY27 bills. So they're planning on, as soon as the president's budget is released, to starting their markups or considering the bills around April 17th and completing all 12 bills by June 10th. The Labor, Health, and Human Services bill is typically one of the last bills that is considered by the subcommittee and full committee. Right now, tentatively, the subcommittee is going to take up the bill in the House on June 5th and in full committee on June 9th. That is, of course, not public information yet, so it is not set in stone, but this is what is being reported as potentially the schedule. The Senate is likely to consider their bills probably in the summer. They typically are a little bit behind the House. They have not put out their member request deadlines where members have to submit their priorities to the committee. I'm expecting that to happen probably soon after the president's budget is released. So I expect the Senate to be on a little bit of a slower track to consider their bills. But I would imagine that we might see a Labor, Health, and Human Services bill maybe by the end of the summer. Again, it's usually one of the last bills to be considered, considering it's one of the largest. It's usually paired a lot of times in committee with the defense bill, since they're both the larger bills. And a lot of times the different parties have different priorities in terms of trying to get those bills done. And if they pair those bills together, sometimes it's easier to get them both through. So another thing to consider in this whole thing is that it's an election year. So that could end up delaying things a little bit. Typically in an election year, you don't see as much legislation getting through. You don't see as much compromise. So it's possible that it's probably not likely that we're going to see bills passed by the end of the fiscal year, as I said. I do still think it's likely that we might see bills passed by the end of the calendar year after the elections, but that's going to probably depend on what happens in the elections. And if like the House switches or something like that, there could be a scenario where maybe if the Democrats can take over the House, then maybe they decide they want to try to clear the decks and get everything finished by the time they take power. It's also possible that they would decide to punt it into the following year when they would be in power to try to rewrite the bills to a little bit more to their liking. So there's a couple different scenarios here, but I think regardless of the scenario, we're looking at least one, if not more, continuing resolutions, punting it a little bit down the road, at least past the elections. I just want to talk a little bit more about the kind of just general outlook. So I think there's more certainty for FY26, given that the spending bills were signed into law versus FY25, where there was a continuing resolution. The agencies are currently, including NIOSH, currently waiting for the Office of Management and Budget to approve their fiscal 26, what they call spend plans. So there's a little bit of a delay in getting that money out the door, but they're expected to get approval for that spend plan soon. So I anticipate that, unlike last year where the 25 money was trying to go out the door, there was a lot of holdups and uncertainty in terms of whether the education and research centers were going to get their funding on time. I'm hoping that this will provide a little bit more certainty in terms of timing, and that money will be able to get out the door more on time. I do know I had a conversation with NIOSH recently. Now that a lot of their staff is back, I mean, they do have some vacancies in terms of people who left during the process of, the several months where several employees were riffed and then they could have potentially taken other jobs. But they are working to get back to normal operations. They anticipate that this is probably going to take a little while, but they're doing the best that they can to try to get back to what they would consider normal operations. And they're working to release notice of funding opportunities, reinstate study sections, things like that. Um, and this would also include for the education and research centers who like submitted their renewals last year, and there were no study sections in place to be able to approve those renewals. And then there's some ERCs that are up again in the funding cycle this year, so they're trying to figure out how to move those things through. Um, and I'm happy to take any questions in general about the process, about what to expect going forward in 2027 or what happened in 2026.
As a reminder, if you do have any questions, feel free to submit those via the Q&A box, and we will go ahead and get those over to you. Our first question regarding renewals, is the same true for TPGs?
I believe so, yes. It's my understanding that yes, they are working with the same process, trying to get things back on a more normal approval schedule and getting those notice of funding opportunities out. And so yes, I believe so.
Our next question, have you heard anything about renewals of TWH Centers of Excellence in 2027?
Total worker health centers. Yes, so they are waiting, I believe, on their NOFO to come out. Again, same situation. Everybody's kind of in the same boat. They're trying. NIOSH is working as fast and as fast as they can to try to get these things out. As you can imagine, there's a little bit of a backlog right now in terms of trying to get all these things out. So I think they're prioritizing them in terms of what is coming up first. But I know it is their intent to get that out.
Great. Beyond NIOSH extramural funds, what avenues of federal funding are we exploring?
So we're in discussions about this right now, but I believe the Department of Defense has a program looking to see if that could be expanded. We're looking at whether there's a CMS route that could be explored. Um, I know there's a HRSA route that could be explored, but it's a little bit difficult at the moment considering that this administration doesn't really want to spend more money. They want to spend less money. So we're trying to explore what is possible right now.
Great. Are there still efforts to create a separate line item in the federal budget for OEM residencies, similar to how pediatric residency programs are funded?
I don't believe that's in the actual budget. I mean, that would be within CMS, I believe. So that's a little bit of a different route. Yeah. But yes, I mean that is something that we're exploring.
Okay. Do we have any other questions that have come in? Give everyone a minute or so before we jump in. Katie, do you have any other closing thoughts or summaries you want to share for the greater group?
I mean, I don't think so. I mean, again, I'm happy to answer any specific questions. I mean, I think that here's hoping that there's this year's budget is a little bit more stable in terms of what we can expect. But I think the last year has taught us that nothing is can be taken for granted and nothing is certain. So we have to keep advocating for what, for this funding. And I think one of the things to remember is this is all local, and to take it down to a local level with members of Congress. And they always want to know how this funding affects their state or their district and their constituents. So I think it's always important to remember to make it personal and to tell those stories, and that's how you get support from members of Congress. And that has been one thing that has been key in this whole fight this past year in terms of NIOSH and making sure to secure that FY26 funding, is just telling those stories and getting those and making sure that members really understand that that this is something that is affecting everyone. And it's also an economic issue for businesses in their states and districts. So just keep telling your story, and I think that's the key.
All right, I think if we have time, we just had another one come in. What options are we exploring to promote public health training to legislators? CMS, presenting data showing prevention saves money over time.
I mean, I guess I'll just say in general, I mean, in the meetings that we just had with members of Congress and their staff, I mean, we took the approach of beginning by just educating, letting them know what ACOM is and what the what this space, occupational environmental medicine, what that is. So I think, I mean, I have to say, I guess right now at some point with some offices, we're just starting with education.
Fair. All right. Well, all right. A few more questions are trickling in. What is the state of things in terms of other preventative medicine residencies outside of OEM?
What is the state? I'm sorry, what?
Yes. State of things in terms of other preventative medicine residencies outside of OEM. It's an anonymous attendee. Maybe can you elaborate on that? Are you wondering the health of the residencies, funding perspectives?
I don't know that I don't know that I have the answer to that question. I mean, I think in terms of, I think everyone's sort of in the same boat in terms of funding levels, but I don't know that I can speak to specific residencies in general. I don't know what.
I think they were looking at funding, like kind of comparing funding with our residencies and other preventative medicine residencies. So I'm not sure if you know it, and if you don't, that's okay.
I'm sorry, I don't know. I don't know the answer off the top of my head.
Alrighty. Well, it looks like that's all the questions that maybe we've had. All right, one more. I'm not sure if you can fully answer this one, but I'm going to try. What is the overall status of OEM residency programs? Meaning, how many closed, did not take the residents due to lack of funding, and how many did not fill their seats this year? How is ACOM working on these residencies to keep them from losing seats?
So I can answer that in part. I think there are 19 now. I think there's maybe two. I could be wrong, but I think there's maybe two that closed. I know West Virginia was one of them, and I don't know the other one off the top of my head. But I do know that some of the programs were able to take residents, although it was somewhat late. I do know there were some programs that didn't take them as well because of the uncertainty. I think that's about all I know on that specifically.
Okay.
Someone in the chat said both Iowa and Kentucky closed. And University of South Florida closed.
All righty. Well, Katie, I would like to, we keep getting a few more in. I'm going to go ahead and utilize our time while we have it. This one, I don't know if you would be able to reach this, and maybe Julie, you might be able to provide any insight on this. Is ACOM and ABPM reaching out to the osteopathic OEM and AOBM to join forces? Julie, I don't know if Katie, you can really speak to that or not.
I know that we have met with them when I first came on board, but I can't speak to what happened before that. I know there had been some meetings.
Yes, I think some of our leadership is in discussion with the American Osteopathic Association and a few like American College of Preventive Medicine. So we have tried to collaborate with other organizations.
Okay, great. Well, we are approaching time here, so just want to thank you, Katie, for all your insights today. I know this is a very timely topic. We appreciate you coming on, giving us an update. If anybody has any other additional questions, feel free to reach out via email. You can submit it to educationinfo@acom.org, and we can get that over to Katie and or Julie to help get your questions answered. We did record today's session. There is no CME involved. However, we will post it on our YouTube channel. We do kindly ask that you do take a few moments and fill out the evaluation, and we're going to post the handout. You'll see an email by this afternoon with instructions on how to access that. Your evaluation feedback helps us shape and format these for any kind of future updates, as we need that feedback to help keep these moving forward. And again, we'd like to thank our attendees for your time today. We appreciate your commitment to ACOM and supporting the specialty. We hope to see you at AOHC and other ACOM educational events. And again, Katie and Julie, thank you so much.
Thank you.
All right, everyone. Have a great afternoon.